Hey folks, it's Friday. It's Friday, March the 19th. I'm sorry I'm late on this. You know, this has literally been one of the hardest weeks I think I've had to go through. I was in the corporate office and it was so cold in there and we were slammed so busy. I decided to try to come home and get this video done uh, and see if I can't post it before Friday gets over with, but we'll see. I don't have an awful lot to go over with y'all today, but I do have some really key things, and there's some very important things I want to update you on. First of all, I made a promise last week that I thought I was going to be able to get out and see a couple of more vaccine clinics. Remember, week before last, I had gone to Chesterfield and McCall, and I really liked seeing what was going on in the various clinics, but I just literally couldn't find any time. This week, we were supposed to be at a National Association of Community Health Centers conference. It's the one that's called the Policy and Issues Forum, and it's the one where we make all these visits. We call them the Hill visits and talk to the senators and congressmen. And of course, we couldn't do that this year, so it had to be virtual. And it was very important to do it this year because there is a lot that the legislators are facing, and we want them to hear the story of FQHC. So we've figured it out and figured how to do it virtually and schedule the meetings, but that wasn't easy. I take a lead on a lot of the conversations, and we had a virtual meeting with Senators um, Lindsey Graham, of course, Tim Scott, of course, and then also Congressman Ralph Norman in our area and Congressman Tom Rice and also Congressman Jim Clyburn. So that was a busy, busy amount of, shall we say, hill visits to do virtually, but it's a good message. We talked about the messages around the difference that FQHCs are making in vaccination. Um, of course, we had several things that we wanted to make the legislators aware of. We need the allowances for telehealth that came about from COVID as an emergency to be able to allow not only F2HCs but rural health initiatives and other practice be able to bill for telehealth. If we couldn't have billed for telehealth, it would have been a truly significant loss because organizations such as ours and others did a lot of telehealth, and we still are. We're still doing close to 10% of the visits that we do by telehealth. So that was on the policy agenda. Of course, appropriations is always on the policy agenda. We are also, as a community health center body, we're asking that Congress consider an infrastructure appropriations. FQHCs haven't had infrastructure funded since 2009. And you might be asking, what is she talking about? What is infrastructure? Infrastructure, simply put, is buildings. Anything that you spend capital money on, big money, that's infrastructure. And we need a lot of attention paid to that. At CARE South Carolina, one of our biggest priorities for infrastructure improvement over the next few years is frankly going to be LATA. That building is in not the best of shape. When it rains, it leaks, and then of course you know about the sewage backup. So that's what infrastructure is. It's a lot better when you can get a grant that can address these infrastructure needs rather than have to go out and take a loan and work on that and so forth. So that was a big part of the policy needs that we were bringing to the congressman. There was also discussions that we were having with them around 340B. I think I've talked to y'all before about that. There are some real challenges around the 340B pharmacy privileges that we have that can really have a devastating impact. And frankly, between you and me, pharmacy has been a big, big factor in us being able to make sure that we didn't have to reduce services or reduce staff or make any significant devastating changes during the COVID crisis. So we don't need pharmacy to be challenged by the 340B issue. So a lot of these issues we had to bring and talk about to the congressman and the senators, and that this was our week to do that. So it was a very busy week to say the least, and a lot has happened with us. We have been approved by HRSA to get vaccines delivered directly to us. Now, this may not seem like a big deal, but it really is a big deal. Um, we will still get the state appropriation of vaccines, but sometimes that is a little iffy. The state has problems, and they, of course, have to supply vaccines to not just us, of course, but to many other entities, hospitals, and so forth. So being able to get a direct vaccine shipment from HRSA is a welcome, and it's a pretty big deal. There's not but less than half of the centers across the nation are being invited to do this, and we're really quite thrilled to be able to do it. But with benefits comes accountability, and we had to meet a lot of deadlines this week in order to accomplish it. But look, we've been accepted now, and we will be able to get our most of our vaccine shipments will still come from the state, but we'll still be able to kind of have more of a consistent supply from HRSA. We're going to try to do some expansion with those new vaccines. So we'll see if we can't increase our throughput in our vaccination clinics. More to come on that. We've got a couple of weeks ahead of us. So that's vaccination. We're going to be rolling the Mobies out pretty soon too. And those Mobies are going to be doing vaccinations. In some cases, they're going to be able to do vaccinations and testing. We're going to see how that goes. We tested it this week, or actually last week, and did pretty good without even any promotion at all when we tested it. That first Moby trip, 20 people wanted vaccination. So it's turning out pretty good. We got some really great news, though, that for the Mobies, one of the things that's going to be developing soon is that we're going to be able to offer the Johnson and Johnson vaccine on the Mobies. This is a big deal because that is a one-shot vaccination. And that's going to be really important whenever we roll those Mobies out because for a mobile clinic, it's going to be really difficult to get patients back for a second vaccination. We're really quite excited about that. Being able to offer that Johnson single shot vaccination in those rural settings with those Mobies, we think is going to make vaccination much more available. So stay tuned. We'll keep you informed about how that's going to go. Switching a little bit away from vaccinations, Denise Ellis, our Chief Personnel Officer, kind of gave me a little sad piece of data this week that we had reached a milestone in COVID with over 100 staff having tested positive, having had COVID. That was kind of a sad milestone to reach. That's a full 20% of our staff, which is a pretty high infection rate. So that was pretty concerning and very worrisome, especially since we don't have but about 232 of our staff that have actually completed the second dose of the vaccine and has reached full immunization or immunity status. I kind of stumbled over that last time, didn't I? Oh, I forgot to put my phone on mute. So excuse me just a minute while I take care of housekeeping that needs to go on. We rolled out the incentive program a little while back and said that if you have achieve full immunity either by vaccination or by giving the HR department proof of having an antibody test and showing that you've had COVID and developed antibodies, that you could have this little sticker, see that, put on your name tag, and with that, we are approving and allowing there to be private meetings going on in private offices, including lunches. So we were hoping that that would really make an incentive. People would say, oh, yeah, if I go get my vaccination, then maybe Susie and I can go into her office and have lunch together. Unfortunately, we didn't see a lot of vaccination happen during the week, so that was a bit disappointing. We have really got to do better on this with staff. We've got to do much better. The jury is still out around what constitutes herd immunity. And you've all heard about this herd immunity. That's when enough people get immunity, either from vaccination or unfortunately having had the disease. There's been some estimates by the experts that herd immunity could be anywhere from 60 to 80% of the population having that immunity. Dr. Fauci, who we probably all know by now, says that he thinks it's closer to more like 70%. At 232 staff, and even with the 100 that have probably had COVID, those tests are not 100% accurate. So there are such things as false positives with being tested. Even with that, we aren't at it. We're not even pushing 60%. We're still less than that. So that's really weighed heavy on my mind. We need more of y'all to get immunized. So I've dreamed up this plan. The executive management team, if we put our brains together, and we've dreamed up another incentive for staff to get immunized. And let me tell you how it's going to go. I have to look at my notes so that I don't get lost on this. So remember that what I said about immunization, and I said about the over 100 staff, which is kind of a sad thing. In order for us to get herd immunity or start reaching around 70%, we need about another 110 staff to get immunized. That's just the bottom line. We don't want staff to go out there and get sick and get herd immunity that way, so we already want to count that. What we need, and I did the math and got it checked by folks, we need about another 110 staff to get immunized. Now, I know there's been vaccine hesitancy, and I understand that. I get it. We're going to throw some incentive, more than the $100 incentive that's already out there. We're going to say that if 110 staff, above and beyond the 230 some odd that are already on their way, go out and get both doses or even just the single dose Johnson & Johnson before April 30th. You with me now so far? 110 staff, fully immunized. You've got to have your second dose or the Johnson & Johnson single dose before April 30th. Then on May the 7th, right after that, I'm going to hold a drawing. I'm going to give away by drawing. Your name has to be in the pot if you've had these immunizations. I'm going to have a drawing of 10 people for $500 Visa gift cards. We're not going to give away TVs. People might not want a TV, might not need a TV or anything like that. It's going to be this. Now think about that. Come on, folks. Talk to each other. Figure out what's holding you back from getting your immunization. Make time. Talk to your peers. Talk to folks that are in the offices, our experts that are there. There's a lot of folks. Talk to Dr. Smith. Um, we need to get Care South fully immunized or at least achieving herd immunity. So the campaign that I'm calling is the Care South Carolina Herd Immunity Campaign. I was rolling this out to some people and they said, "Oh, good. We can see a lot of good graphics on this campaign. Cows." I don't know about having cows, but I'll leave the PR and the marketing people up to figure out how to promote this Care South Carolina Herd Immunity Campaign. We've got to make this happen. We don't have any choice. We don't want to go into the summer like we did last year. We had huge spikes around cases, and some people got pretty darn sick around it. We've got to get our own facility herd immunity. So join the Care South Carolina Herd Immunity Campaign. Make yourself eligible. Get your immunization. And then on May the 7th, let one of the names that get drawn be yours. A $500 Visa card, that can make a pretty big difference. I'm going to update you on just one other thing before I call this, because this is ending up being a little bit long video. You may be asking yourself, well, what are they doing about Dr. Smith and his situation is dragging on about being the interim CMO. We have been working on this, and we are now down to 2 candidates. We have an interview. Actually, we had an interview today, and we've got another interview, the final interview scheduled for next week. So, folks, we are very, very close on this. You don't know how fortunate we are to be able to have the person that has been filling the CMO position still staying home with Care South. You know, that's a lot of questions that candidates raise. Well, why did the last CMO leave? And it's making a big difference with those that we have now interviewed and those we have touched base with on the screening bit. So we have truly been very, very fortunate that Dr. Smith is still staying with us, going to be doing the work of doctoring and playing the role for which he has been so much of a benefit in our medication assisted therapy. But we are getting close, and I think that we should have our decision definitely within a couple of weeks. Our 2 candidates that have been for interviews have been exceptional. So it's with a great degree of optimism that I'm able to report that to you. Folks, have a very good weekend, but stay safe. Think hard if you haven't gotten your immunization. Study up, talk to folks. It could be $500 gift card right in your pocket on May the 7th. But that shouldn't be the only reason. Do it because we want Care South to be a safe place for you and all the patients that we're serving. Let's make our herd get herd immunity. Y'all take care. Be safe. Bye-bye.